name is Nicole Perazzo, and I will be recording an assessment, a neurological one. This is Jeannie. Jeannie, do you consent on having this done?
Yes.
And Jeannie, can you repeat after me? I, Jeannie.
I, Jeannie.
Accept to being assessed.
Accept to being assessed.
And having this video uploaded to Alphabet.
And having this video uploaded to Alphabet.
Great. Okay, we're going to go ahead and scan the room. Going to show my note card. Great. So first off, Jeannie, I'm a nurse. I'm going to be doing a neurological assessment on you. Okay? I'm going to first wash my hands. All right. First off, we're going to go ahead and check mental status. Jeannie, do you know where you're at right now?
In my condo.
Good. And what is your full name?
Jeannie Atterbury.
Good. And do you know what today's date is?
December 12th.
Good. So we want to make sure the patient is alert and oriented to date and time. Next, we're going to go ahead and move on to the olfactory. So Jeannie, if you could close one side of your nose for me. Or, close your eyes. I'm sorry. And tell me what you smell.
Coffee.
And the other side?
Coffee.
Great. Okay. Next, we're going to do ahead in the optics. So we're going to do the smell chart. Jeannie, I'm going to give you your glasses. We're going to take 20 steps this way, and we're going to go ahead and read the chart with your glasses on, okay? Okay. So go ahead and do both eyes. And tell me the last line that you can read.
CZP.
Good. So that is 20/30 for Jeannie, and I'm going to have you cover your right eye, or your left eye, which is OS.
EDF CZP.
Okay, that's 20/30, and cover your right eye.
EDF CZP.
Okay, so left and right eye were 20/30. Go ahead and have a seat, Jeannie. We're going to continue on with the optic testing. So we're going to go ahead and do the visual fields, and we're also going to check the ocular fundi. I'm going to come at you with the slide, okay? Just go ahead and look forward. I'm checking red reflex, which is present in Jeannie. I'm going to go on the other side. Sorry. Great. Okay, next we're going to go ahead and test the visual field. So close one eye. Same, good. And then when you look at me, tell me what finger number you see.
1. 1. 1.
Good. Other eye.
1. 2. 1.
Good. Next, we're going to go ahead and move on to the cranial nerve 2 and 3, which is the optic and the oculomotor. So we're going to test our pearl here, and we're also going to check for the near response. So, Jeannie, if you can go ahead and look forward at me, we're going to go ahead and I'm going to check your pupils, making sure they're reactive to light. And here, Jeannie's pupils are measuring about 3 millimeters, appropriately relaxing their pearl. Next, we're going to go ahead and look at the tip of this right here. Look at my shoulder. Look at the tip of this. Look at my shoulder. Good. Here we're checking for near responses, making sure that the pupils are dilating appropriately, looking at far distances and near distances as well, accommodating. Next, we're going to check for cranial nerve 3, 4, and 6. So that is going to be the oculomotor, the trochlear, and the abducens. Here we're going to go ahead and do the 6 cardinal movements, and we're also going to do the convergence test. So, Jeannie, I'm going to have you go ahead and look at the tip of this, and we're going to watch and make sure Jeannie's eyes are crossing appropriately. Good. Okay, go ahead and look at me, look at my nose, and you're going to follow my finger with your eyes. Here are the 6 cardinal gazes. We're watching phrenicotosis, nystagmus, which there is none, and she's appropriately moving her eyes. Great. Next, we're going to go ahead and move on to cranial nerve 5, which is the trigeminal. So we're going to do the corneal reflex, which is with a cotton wisp, and we're also going to do facial sensation and jaw. So, Jeannie, I'm going to wisp this. I'm going to come at your eye with this, okay? Here, the eye should redden, and Jeannie is reacting appropriately to this. Jeannie, can you go ahead and feel my face? My fingers? Good. Okay. Can you do me a favor and show me your teeth? Chew down. Good. And move your jaw side to side. Good. Next, we're going to go ahead and move on to cranial nerves or facial nerves. So we're going to go ahead and check the strength, and we're going to check movement. So go ahead and puff out your cheeks. Smile. Good. Push your hand against my hand. Other side. Good. Next, we're going to go ahead and move on to cranial nerve. It's going to be the acoustic one, so that is going to be cranial nerve 8. So I'm going to go ahead and whisper something in Jeannie's ear, moving her hair out of the way. Can you hear this?
No. Call me.
Good.
Present.
Yep. Okay, good. So next we're going to move to cranial nerve 9, which is a glossopharyngeal. So here we check for the gag reflex and also the swallow, and we're also checking for 10 for the vagus nerve. So I'm going to have you, Jeannie, go ahead and stick out your tongue, say ah.
Ah.
And here we perform the gag reflex. Jeannie didn't want to do that for this test, so we're going to go ahead and just say what we would do for the test. Next we're going to go ahead and have you swallow. Swallow for me, Jeannie. Good. Cranial nerve 11, we're going to do the spinal accessory. So move your head up and down for me, side to side, round and round. Good. Next, we're going to go ahead and do cranial nerve 12, which is a hypoglossal. So go ahead and stick out your tongue, side to side. Good. And that completes the cranial nerves. Next, we're going to go ahead and move to muscle strength. So I'm going to go ahead and have you squeeze my fingers. Squeeze, squeeze, squeeze. Good. I'm going to have you go ahead and put your wrist down and pull up. Good. I'm going to have you show me your muscles. Pull out, pull towards you. Push out. Good. Tee out your arms for me. Push up. Okay, push down. Good. Now we're going to do the ankles, knees, and the feet. So I'm going to stick out your feet, Jeannie. Press down on the gas. Push up. Good. I'm going to have you go ahead and push down. Push out. With your leg, push out your legs. Good. Push out my hands. Good. And then push in. Good. Good strength. Next, I'm going to have you go ahead and have you go to, you're going to touch your nose, touch my finger, touch your nose, touch my finger. Good. Other hand, touch your nose, touch my finger, touch your nose, touch my finger. Good. Next, I'm going to do serial hand movement. So, Jeannie, if you can put your hands on your legs, and go ahead and flap your hands for me. Back and forth. Good. Next, I'm going to make the OK sign, and put your fingers like this. Good. And here we're just watching Jeannie move her fingers and her coordination. Great. I'm going to have you go ahead and stand up for me. We're going to do some walking, regular walking and tandem walking. Just take a few steps here. And then one foot in front of the other, we're going to do tandem walking, just back to the chair, okay? And then still stay standing. We're going to go ahead, face over here. We're going to go ahead, close your eyes, put your hands on your shoulders, and here we're going to watch for any swaying. Notice for any cerebral defects here. Okay, thank you, Jeannie. You can go ahead and have a seat. We're going to be almost done. Then we're going to move to spinal thalamic. So we're going to do hot and cold and pain and dull here. So let me know if this is sharp or dull. Okay, Jeannie?
Mm-hmm. That's sharp.
Okay.
That's dull.
Okay, down here.
That's sharp. That's dull.
Okay, good. Next we're going to do hot and cold. So let me know if this is hot or cold, Jeannie.
Hot. Cold.
Good.
Hot.
Good.
Cold.
Good. Okay, next we're going to go ahead and move on to light touch. So let me know if you feel me touching you, okay?
Mm-hmm. I feel you.
Feel me?
Yes, I feel you. I feel you.
Good.
I feel you. I feel you.
Good. Does it feel the same?
I feel you. I
Yeah.
feel you. I feel you. I feel you.
And we're here, we're checking, making sure it's the same on each side. Next, we're going to go ahead and do the posterior column. So we're going to do the vibrate test, and we're going to do the proprioception. So let me know if you feel this vibrating, Jeannie.
Yeah. Yes.
Okay. Let me know if you feel this.
No, it's not right.
Okay.
No.
Okay. Good. Next, we're going to go ahead and move on to proprioception. So, Jeannie, close your eyes and hold out your hand. Just identify what object is in your left hand.
A pen.
Okay, and this hand?
A clip.
Good. Next, we're going to go ahead and draw a number in your hand. Keep your eyes closed and let me know what this is. The past test was stereogenesis. This is graphesio.
1,
Good.
3.
Good. Okay. Next, we're going to go ahead and move on to the last part, which is the deep tendon reflexes. So, Jeannie, just relax your hands. I'm going to tap on you, okay? Good. Good. Okay. Good. Good. And press this arm. Good. And now relax your knees. Relax your legs. Good. Good. Last one. Just relax your leg. Last one. Good. And this completes our neurologic exam with Jeannie. Thank you.